controlled articular rotation for the hip joint. So we're setting up in a sideline position for this one. We're also making sure not to move at our spine throughout. So I want to lock my spine in place, keeping a neutral spine, and isolate the hip joint. My head is going to rest down on the free arm, and I'm going to bring this hand up out of the way, pressed into the floor. So the first motion, we're going to bring this hip up into hip flexion as high as I can without any compensations happening at the back or spine. Once I'm out of hip flexion, we're going to go into hip abduction, where the knee and leg rotates or abducts away from the midline. We're then going to go into hip internal rotation. So keeping the knee frozen in place, I'm going to internally rotate. The heel will move up away, and then I'm going to extend the hip, moving by extending through the glutes, not the lower back. So make sure again not to extend at the low back. And that finishes our half circle. I'm then going to reverse the motion. So I go back through hip extension, squeezing the glutes, making sure not to arch the back or dump the pelvis forward. I then abduct away. I then have external rotation. I'm trying to rotate the femur, and then finishing back in the start of the hip circle.